Tony is the executive director at the Network of National Library of Medicine and Health Sciences. He's based at the University of Maryland in Baltimore. However, he is on vacation today, and so he is speaking from Ohio. Tony has a master's in library and information sciences, and he oversees the planning, implementation, management, executive evaluation to support the National Libraries of Medicine. He is on call quite often and says he doesn't mind speaking while he's on vacation. I gather this is a labor of love, and we are so pleased that you could join us today. Thank you, Tony Nguyen.
Well, thank you all for having me. I am going to set up my slides. And, well, no, I can't do that yet. I need to share my screen first. Screen 2.
Please mute, by the way, so that background noise and noise clutter won't interfere. So please mute unless you have a question later on. And if you do have any questions, you can always put in the chat.
And I will open up my chat window as well in case you have any questions. I should be able to see them. Unfortunately, I won't be able to see your faces while I'm presenting those. So yeah. Welcome. I am presenting this presentation, Health in the Headlines, Learning to Read Between the Lines. Again, my name is Tony Nguyen. I'm the Executive Director for the Network of the National Library of Medicine for Region 1. The National Library of Medicine's, the NNLM serves as the engagement and training arm for the National Library of Medicine. And Region 1 is comprised of 8 different states and DC. Here. The NNLM engagement and training is primarily under 3 different areas: training programs offered online or in person, funding programs to support community health information outreach, and outreach to under-resourced populations, especially those underrepresented in biomedical research. You can visit nnlm.gov for more information. This presentation examines how health information is reported in news outlets and popular media, and how to critically analyze these health claims. Critical analysis of news stories involves critical thinking. You will be introduced to a few different rating instruments to develop this skill. While we won't have time to practice these instruments during the presentation, I hope you'll be able to apply it to health news that you read. Just as no study is perfect, no health story in the news is perfect, but developing the skill will aid you in identifying common reporting issues and teach you to seek more information. So I've broken this presentation down into 3 different areas: understanding the landscape of health news reporting, analysis, and then popular health information. This presentation primarily focuses on a rating instrument from Health News Review, a project designed to help consumers critically analyze health stories presented in the news media. For over a decade, Gary Schweitzer and a team of contributors evaluated hundreds of news stories and published over 6,000 articles. Within this session, you'll see content from healthnewsreview.org. While this project is no longer funded, the website remains live and serves as a useful resource. For more information about this project, you can visit the website that I've shared on this screen. And I'll share another resource from the National Library of Medicine, as well as possibly a familiar one that you may have seen before. This session will cover the 5 objectives listed on the slide. And while we have a lot to cover, I will just begin. So the first thing I wanted to do was just ask everyone, how do you evaluate information? Is there any criteria that you use? You can share in chat, or you can unmute your screen if you'd like.
I would say a lot of times when I hear information that I would look for other sources to give me the same information to corroborate it. So, you know, and that's a teaching thing because I was a teacher so many years. So I like to look at more than one primary source to make sure that this is not biased and it is something that I can believe in.
Okay.
I'd like to go back to the original articles also.
Look at the original articles. Great.
Yeah.
All right.
I verify with family members who are physicians. I have several, including my daughter. And so I just say, is this reality or are these false statistics or whatever? And they usually send me to other sources to confirm or deny.
Okay. Thanks for sharing. I think that was Marcia. I think I heard Cindy and Gail.
Right.
So thank you for sharing that. Let's move on. Throughout this session, you'll learn of how to evaluate health stories reported in the news. But you're not alone. There exist agencies that work to debunk inaccurate reports. And then we'll have, like, take, for example, this particular story on cancer-fighting properties of corn tortillas, which was reported by several news outlets, but a group called iMedia Ethics contributed to debunking this story and investigate similar content like this on an ongoing basis. So I encourage you to look at these resources to see about debunking some of the stories that you discover online. One tool a lot of people may be familiar with is the CRAP test. This test was created by Sarah Blakesley of the University of California at Chico Merriam Library. You'll see here that each section refers to, and the questions considered that you should consider related to each category. I won't read everything on this slide, but I do think it's important to break down the acronym. Currency refers to the timeliness of the information. Relevance refers to how the information fits your needs. Authority is related to the source of the information. Accuracy, reliability, and correctness of the info, and purpose is the reason the information exists. The link that I provided here will help give you some more information on utilizing this particular model if you're evaluating health information. So I need to see about hiding the very top bar. I'm sorry about that if it shows up on your screen.
Looks okay.
Okay. So the question remains, though, how do we get from the reported information from researchers to what is actually shared to the public? So here's one particular example of the research article that was published where it gets evaluated and a popular news media will take the story and share it to the public. So let's look at where health news stories come from and the reasons behind why stories may misrepresent health research. We'll learn about different types of news agencies and the journalists and writers that create content from them. And then finally, we'll introduce you to another rating instrument that you can analyze these stories. This exercise of analyzing stories in the news, as you'll learn to do this presentation, is often referred to as news literacy. News literacy is the ability to determine the credibility of information presented in popular news formats, such as the newspaper, the radio, or on television. Specifically, we'll introduce you to health news literacy here and the factors tied to evaluating health news stories that you discover. The process of analyzing news stories involves developing your critical thinking skills and determine how reliable the information is presented. So when you read about health in the news, it's important to understand that you are not reading the original or primary source of information. Instead, the information has been interpreted and summarized for you by a third party. Stories about health and news generally come from these original sources. In the content of healthcare stories in popular media, such as newspapers, magazines, the information from the original source is often interpreted by a journalist or a freelance writer. It may not surprise you then that the message can be lost in translation. This comic illustrates how many times original research can be translated until it gets to the public. You'll see some of those sources we shared at the beginning of the news cycle, which is shared then by the public relations office of the university and then picked up by a news agency such as the Associated Press and is later broadcast through newspapers and other media outlets. Healthcare journalism requires skill in finding story ideas and facts, cultivating and maintaining quality sources, presenting news in a way that serves the public's interest, specific talents for research, interview and distillation of information, sifting rants from reality, and presenting articles with clarity, accuracy, speed, and relevance. The Association of Healthcare Journalists publishes their mission as dedicated to advancing public understanding of healthcare issues. Some media outlets are fortunate to have a specialist journalist experienced in interpreting and relaying health information, and it matters. A team of researchers in Australia ran a study of specialist and non-specialist journalists and found that the quality of health information stories is higher when written by a specialist. And this was a study done by Wilson et al. In 2010. Interpreting original research studies on health topics takes skill. Some topics that trained healthcare journalists learn are difference between animal and lab studies versus studies conducted on humans, composite outcomes or studies that measure more than one outcome, which produce combined results and can be misleading. Conflicts of interest, something you learn more about through this course, and phases of drug trials, FDA approval, cost of the treatment. Those are things that are considered. And unfortunately, the challenge is that many mid or small-sized news agencies do not have journalists trained in interpreting healthcare research. In a study published in the American Journal of Public Health, the author revealed that nearly all reporters covered health news at Midwest papers had received no training in that particular subject matter, and that was done by Voss in 2002. The availability of specialists depends on the type and size of the news agency. So the Associated Press, Reuters, United Press International, and Bloomberg are examples of some of the major news aggregators in the US. You may recall seeing articles from the AP in your local newspaper. These large agencies often have journalists or freelance writers trained in interpreting health and other scientific news. Large media agencies such as the New York Times, the Washington Post, and NBC News often have a budget dedicated staff to health and medicine, often a doctor, someone with a science degree, or someone who has developed a base of health and medicine knowledge, and or a network of contacts in the field as well. Small town newspapers, generally with circulation below 50,000 or medium-sized TV markets, are most likely to employ writers with no formal training in health, medicine, or even in science. They often rely on the major news wires or the internet for stories, and employers rarely fund staff training to attend continuing education or professional conferences. So consumer health or lifestyle magazines like Men's Health, O, and Cosmopolitan often rely on freelance writers who are contractors for health and medicine articles. A lot of the time, health news stories can come across like this, looking at coffee, chocolate, wine, eggs, etc. Are they turning them on? Are they turning them off? And it can be a little confusing at times for the public then. So journalists or news writers are often challenged by the pressure from news agencies to release information quickly. competition from other news stories and news outlets, which leads to a bias towards sensational headlines, and a lack of training in interpreting health research. Finally, there's a reliance on sources such as press releases that are not unbiased. So the pressure to rapidly release news stories contributes to the misinterpretation of information and the ability to keep stories concise for public consumption. And that leads to omissions that are important in the context of the study. Content is often picked up by the media outlets without verifying the information, and that results in the rapid distribution of inaccurate or untrue news stories. Many healthcare consumers do not realize that research, academic, and medical institutions are reporting their information through a PR department. Public relations are about maintaining a positive image for the institution that they represent. So when the results of the new study or use of certain medical technology is delivered by that institution, public relations, not all of the information is relayed, and it could be skewed. Health information delivered in this way does not allow for in-depth reporting, and that can lead to several issues. So let's look at a couple of real-world scenarios here. The pressure to release news stories quickly can result in the rapid spread of inaccurate information. An interesting case study is that of John Bohannon, a science journalist who set out to illustrate how quickly false information could be spread by the media. Bohannon conducted a low-quality research study and paid to publish it in a pay-for-play journal with no peer review process. This type of journal is sometimes referred to as a predatory journal, meaning that the publication has poor quality standards, unethical research practices, and is driven by revenue from authors seeking to publish. A journalist picked up the story, and it was shaped by a number of news agencies. It was published in Modern Healthcare, Huffington Post, Prevention, and In Shape magazine. Examples from the Daily Mail Australia, even the update has issues. There is an NPR interview with John Bohannon related to this study. So regarding clickbait headlines, you often look at sensationalized headlines, high interest topics like nutrition, stress, exercise, sleep, sex, etc. And it can distort your findings. Uncritical reporting of news releases from research organizations, the emphasis of potential benefits while ignoring side effects and variables, and then they're rapidly disseminated. So there's reporting can be very competitive and time consuming. And then there are a number of different copycat stories that are a cheap and inefficient means of producing content. So consider the listed headlines and the assumptions a reader could make after reading them. And then here are some questions to ask about clickbait headlines to mitigate those assumptions. Where did the information originate? Was it a press release from the organization who conducted the study or research, a health report from another news organization? Is there evidence or data to corroborate the claims of the headline? Then finally, this one. Let's explore that original example. Sensationalized story promoting with an unusual premise and corresponding comical images. You'll see some distortion. Scientists involved in the study never made this claim. The press release from the University of Exeter claimed rotten egg gas holds key to healthcare therapies. And it becomes widely shared. Dozens of news outlets were reported of the story. Few sought out the original study to prove its veracity. And then there are a number of copycat stories that came out, and they're a cheap and efficient means of producing content. So let's shift a little bit and look at different types of news agencies and the journalists and writers that create content for them. We'll be using a ranking instrument used by a project called Health News Review to evaluate health news stories for accuracy. This instrument has been developed specifically for evaluating healthcare news to support the public in making informed health decisions. This instrument is provided here for reference and is available in a printable format later on. Remember, these are just guidelines, and no one will always carry something like this too. So just keep this all in mind. And here are the other 5 things that you would have to think about as you're reviewing news stories. And again, I will share a PDF of these slides so that you can have it available later. Often referred to simply as selling of the disease. Identifying disease mongering is a matter of judgment. Sometimes it's obvious, sometimes there's a fine line about whether an article on irritable bowel disorder, erectile dysfunction, restless leg syndrome, or osteoporosis, all of which can be serious for many sufferers, is misrepresented on the condition to the public. Most of the conditions we list are not life-threatening, but a lot of things that you may see are fixated on LDL cholesterol numbers instead of evaluating whether studies showed a change in how well or how long people live, and whether treatment results in fewer cases of heart disease or fewer deaths. Beware of the statistics that may inflate the seriousness of a condition. Beware of headlines that exaggerate the human consequence of a condition. Millions of us are suffering in silence with toenail fungus, for example. I mean, that's not really suffering. Beware of interviews with worst case patients, holding such patients up as examples as if their experiences were representative of the whole. And also think about the useful discussion on the prevalence of the condition under the discussion and if that prevalence could possibly be inflated. So here's one particular example about Marissa Tomei opening up about the struggle of chronic dry eye. And here is one thing to highlight related to this is that there is like utilizing a famous actress or actor to promote a particular drug, for instance. We repeat, newer isn't always better in healthcare, and it may not really even be newer. Stories should establish just how novel the thing is. Resources for establishing novelty are prevalent. You can go to clinicaltrials.gov and that can provide some information about other studies that are currently underway, the specific treatment or a particular condition. It can be useful for providing content about something seemingly innovative. You can also go to pubmed.gov and you can put in a keyword or two and figure out whether something is absolutely unique, and if not, how long it's been around for and studied. Here's an example of this as well. It's not clear why the study is being written at this particular point. The research that most directly addresses the question of whether vitamin A can help with COPD was apparently conducted 20 years ago. Is there anything more reason? If not, why are we talking about it? Otherwise, readers are left to wonder if they've missed the news part of the story. Another question to ask is, does the story discuss the cost of the health intervention? And does it disclose that? If not, what exactly is the intervention? Throughout the criteria, the intervention is the health test, procedure, or product, such as the drug or medical device. You should get some idea of the story about the cost of the intervention. For example, in a story about effectiveness of a new drug, does the story contain information about the cost of the drug? Cost of new interventions can be difficult to determine, but readers should expect to know whether the cost of the intervention is and how it compares to other approaches. A better story may indicate whether or not health insurances are likely going to cover the cost of the intervention. So consider this story about IUDs and hormonal implants. From your perspective, does this article adequately address the cost of contraceptives? The author of this news story addresses both the higher upfront costs of these contraceptives and other information on the likelihood that the intervention will be covered by insurance plans. This is a good example of a news story that addresses cost, but how could it be stronger? Moving on, does the story identify conflicts of interest? You should be informed if the sources of the news stories have financial or other relationships that may indicate bias. Conflicts of interest may include a study on a drug paid for by the drug manufacturer. A researcher studying a drug may also receive pay from the drug company or researchers who are seeking patents for their intervention. News stories should identify the source of the story, whether it is a journal article or news release, and state any conflicts of interest. Consider this news story on Januvia, a diabetes drug manufactured by Merck. Does the story adequately address any of those conflicts of interest? This one is tricky. You probably noticed this paragraph at the end of this article indicating the study was part of a collaboration between two independent academic organizations. This is usually a good sign, although the story would have been improved if an independent expert was consulted rather than only the study authors. Interestingly enough, if you were to dig deeper and locate the original studies that the news story is based off of, you'll see that it was funded by Merck. It's okay if you don't catch this, because we'll cover sourcing articles later on. So here you'll see in the conclusion that it was funded by Merck, Sharp, and Dome. Does the story compare the new intervention with existing alternatives? New doesn't necessarily mean better. In fact, there is more data available to support established interventions. When a new intervention is presented in a health news story, it should contain some information about existing interventions, if there are any. Findings on the new effectiveness of something that comes out should be presented against the effectiveness of what's currently exists. What should you be looking for? At a minimum, alternative treatment should be mentioned within the story. So let's look at this study on anti-epilepsy surgery for children. Does the story compare the new surgery to other alternatives? While the article does make reference to seizure medication, it does not get into the detail about which drugs are commonly used and what the success rates are for these alternatives. A stronger article would list the drugs and offer more detail about the effectiveness of those alternatives to the surgery. Health news stories often report on the interventions presented and present the intervention as something currently available to readers or patients. Often, these new drugs or medical devices may not be on the market yet, and it may take years before they are available. Before new medical interventions become available, they're subject to approval by the U.S. Food and Drug Administration, which takes a lot of time. Also consider that an intervention approved for use in another country does not mean that it's approved in the US. For interventions that have been approved, expect to see information about availability. If the intervention is a new surgery, for example, where would patients be able to get the surgery? And I apologize, I think a fire truck is rolling by, so I'll wait for it to pass. Okay, it's gone. So let's look at this story on the use of worms to cure allergies. Does the story address the availability of the intervention? The fact that the patient who went to Mexico to obtain the hookworms, the intervention presented here, implies that they are not readily available in the US. Further research on your part would be to reveal that selling of worms for therapeutic use is illegal in the US, something that should have been mentioned in this particular story. Does the story adequately explain the benefits of the intervention? Health stories should contain information on how effective the intervention is and should back it up with data whenever possible. It's always important to consider the type of data shared. If the story states that 1 out of 3 people have an increased risk of stroke, readers should know that the population studied, what the population of the study was. As a critical reader of health information, you should always ask yourself, out of how many? This also illustrates the importance of presenting risk as absolute rather than relative risk. An example of a statement of a relative risk is, a new drug reduced the risk of stroke by 30%. Absolute risk represents the total population studied and reduces and details the population, which is applicable. An example of this might be, a new drug reduced stroke in 2 out of 100 patients, or to 1 in 100 patients. So you can learn more about what healthcare journalists go through through a video that I can share later on if you're interested. Let's look at this article about the early results of T-cell therapy for leukemia patients. Does this article adequately detail the benefits of the intervention? This wasn't easy to identify either, because the story put a lot of focus on the anecdotal story of one patient. It doesn't really share what's included in the particular passages. Does the story adequately explain the harms of the intervention? Many health interventions include the risk of side effects and complications commonly known as adverse events. When a story is shared about health interventions, it's expected that there will be discussion of any adverse effects. Ideally, a news stories will include information about side effects, including the severity and frequency of effects. If harms are unknown, for example, in the case of preliminary health studies conducted on animals, it should state that the harms are unknown. For information on this, I can share a video so that you can watch this later on. So here's another example on surgery to remove blood clots in patients who suffered strokes. Here, you need to ask, is there enough information in this article to adequately understand the potential harms of this intervention? This article, the potential harms of the surgical procedure are not discussed. Given the risk involved in a surgical procedure like the removal of blood clots, potential harms should be part of the story. Remember, potential harms may be outweighed by potential benefits, but there must be enough information presented for readers to make that particular decision. Does the story include the quality of the scientific evidence? When we talk about this criteria, we're often talking about the type of study and the way that it was conducted. The type of study can indicate the rigor of the research and how generalizable it is to another population. For example, was it an animal study, a small study involving just a few participants? Did it come from a large randomized controlled trial? Evidence in a complex topic you can dig deeper about by accessing some of the optional resources that I can share later on. But you should have a basic understanding of the sample size, animal versus human studies, and how the study was designed. I am looking at the time and I have 5 minutes, so I need to apologize, and I am going to jump several slides, if that's okay with you, to go to verifying information. So many reputable news outlets generate revenue through advertising, but it is becoming difficult to distinguish advertising with the growth of native advertising. Native advertising is a practice of creating advertisements that blend in with the surrounding content, usually news stories. In order to address concerns about consumers being deceived by native advertising, the FTC released guidelines back in 2015 about the proximity, placement, and prominence of disclosure. This guideline on technical advisory is not binding. Take a look at this advertisement about reducing stroke risk, for example. What distinguishes this from a news story? It's really tricky because oftentimes people will miss the signs that this is a news article and it's in fact a paid advertisement that is shared. Another researcher investigated the biological, psychological, and social processes that explain celebrities' influence on patients' health-related behaviors by delving into 5 different disciplines. That includes breast cancer, skin cancer, colonoscopies, alternative medicine, weight loss, HIV, and vaccines. So I won't necessarily go into too much detail, but for economics, you'll think about celebrity endorsements act as markers for different endorsed items, such as competitors, and it creates this herd behavior then. Thinking about marketing, you'll think about the source credibility and the halo effect oftentimes. And then there's a neurological science or neurological mechanism of transferring if a celebrity promotes something as well. So I am looking at the time and I'm speeding even faster. So I'm really sorry about that, but I will share these slides later on. Looking at the negative impacts of celebrity influence, you'll look at the celebrity endorsements don't usually target those most at risk for a specific health condition. There's overutilization of testing or treatment resulting in unnecessary expenses to the healthcare system, as well as the individual patients who may not be able to afford the healthcare celebrities don't think twice about. And it can cause more health problems due to trying to endorse treatments that are not evidence-based. There's a spread of misinformation then about health conditions, tests, and treatments. Awareness of specific health conditions, as well as reducing stigma associated with such health conditions as mental health, there's an increase in patients getting medically recommended preventative tests that normally is underutilized. And then there are endorsements of scientifically proven health procedures, and you're encouraged to donate blood, bone marrow, and organs. Even the National Library of Medicine uses celebrities to bring awareness and advocacy about specific health conditions or concerns that have affected themselves or a family member. And you can see this when you look at the Medline Plus magazine, for example. So evaluating the validity of celebrity endorsements or advocacy is no different than evaluating any other source of information. And you can go back to the CRAFT test that I mentioned a while ago to look at this and look at the relevance, the authority, accuracy, and purpose of what it is that they are discussing. News literacy is often increasingly important due to the amount of information published and the method in which it's created. In the past, information produced by a third party, like an editor or publisher, is distributed to audiences. This form of content generation and distribution is known as media mass, or mass media. Sorry, I'm getting a little tongue-tied here. Anyone can create content these days. One place that user-generated content exists is in social media platforms like Facebook, Twitter, YouTube, and Instagram. Unlike mass media, social media involves content generated by multiple people and shared with multiple people as well. User-generated content on social media contributes to an overall rise in information and a rise in information published that has not been verified by a third party. So news literacy is increasingly important due to the amount of information published and the method in which it's created. In the past, information produced by a third party, such as an editor or publisher, and distributed to audience. This form of content generation and distribution is known as mass media. Today, anyone can create the content. One place that user-generated content exists, again, with social media. And this creates a lot of issues down the line. The sourcing of health news stories found on social media to determine if the news stories came from an authoritative source, such as a scientific journal, may be the best way to verify the information. So here you'll see a potential tutorial that you can utilize. This tutorial teaches you how to evaluate the health information you can find on the internet. And it's divided into 5 particular sections. So you can use the navigation bar at the top of the arrows on each of the page to move forward and backward when you do this particular tutorial. And it should only take about an hour to complete this tutorial. And there's also a checklist that you can download on evaluating any health information that is available online. So with that, I apologize for going too fast and skipping a few sections here and there, but I wanted to get through that with you as quickly as possible and make sure that I didn't miss anything. I know that there were specifics that I needed to cover as well, so that's why I skipped a major chunk in evaluating like how studies are created from a clinical trial, phase 1, which may just be animal studies, to phase 2, which could be a small group cohort of maybe 10 to 15 people, and then moving into a phase 4, which is a randomized trial of multiple groups being divided out and tested. And it could be, it could have thousands of participants in the studies in a clinical trial phase 4, for example. Covered a lot. I'm sorry that I went very, very, very fast, like very fast.
I'm sure that you could have given us a lot more information if we had more time. But in the remaining time, and thank you for the information that you gave us. In the remaining time, is there any specific questions that maybe that Tony didn't even cover that might be on your mind about what the subject is today? Susan, did you ever? No.
I will say now that there are things showing up on social media, like Twitter and Facebook, for example, that that list bias and things that you might scroll through when you're looking at your news feeds. So those are becoming more prevalent. And then there are things that also mention that this may be considered satire when it's published as well. So that is something to like double check, because I am seeing on social media more and more, like whether it's a paid endorsement or if it's satire being published or something else. So I think in the last presidential election, you can see a lot of things saying that the story was not verified or anything on social media too, which I think is helpful for a lot of people, but I think it's still missed by a number of readers.
I think in today's world, dealing with what we're dealing with social media, there's a lot of false news, or that's
a lot of false news.
And to say if someone made something in the false news because of it's biased and they want to just to vent their information, I guess that behooves us to find a credible source and to really do the research to say if this is really real. Unfortunately, there's so many people out there that don't do that. And they're listening, they're searching for what will make them feel good.
It's very difficult though for a person, and I know this because my mom is English is her third language, to read a scientific journal article written in English, because it's just not in her purview of thought, in all honesty. So it's difficult for those who English might not be their native language to look at something with a ton of Latin mentioned in how things are described. So I definitely keep that in mind. And I know that in the US, the average reading level is honestly a 6th grade reading level, if you're lucky. In some parts, it's actually a 3rd grade reading level. And when someone is told they have a specific disease, there's the panic that occurs, and they'll automatically go to social media to say, what can I do? And people will share their particular stories. And if they know that person, they'll try it out versus anything else. So if you hear, say, for example, my mom, when I'm sick, would say, oh, just drink some chicken noodle soup, you'll feel better, for example. And then when I got older, it was like, oh, drink some bourbon and that'll help your throat clear out, which is true because it burns. But, you know, there are all those like folk tales that occur that you just do without thinking. And when there's like a serious disease related to, say, breast cancer, for example, you will hear a ton of people have their own stories and their own journeys, but not realizing there's a difference between BCRA1 and 2, whether there's stage 1 cancer versus stage 4, where things have metastasized and affected another organ, for example. So people have multiple different individual stories. So when someone says, I have this cancer, what someone tells them on social media, and it could be a loved one, it could be someone else that they sort of trust, it can be a difficult thing when you're taking in so much information from so many people. And then if you start doing let's be honest, people will use Google to search. I'm a librarian, I can say that. But people will use Google to do a search, and they'll look at the first 3 hits, for example. And the first 3 hits are from, well, what shows up a lot of times, the first 2 will be advertisements. And your Google search might say in tiny letters, ad, or sponsored content, or something like that. And that shoots it way up to the top versus the reliable source of information, which might be the 5th or 6th item, maybe even on the 2nd page. No one really looks in much detail anymore when they're doing a search, and they might take the first 1 or 2 hits, and you might get something from an individual selling a book about their individual story versus some study that had 100,000 people in that study.
Yeah, I agree with that. You know, that people don't want to read a lot. They'll go for the easy way. When I go in internet research, and I taught technology, and I taught kids how to evaluate, I ignore all the ads and go to more credible sources, but that's just the way I am. My question is there a website or some place that that someone can go that evaluates or says that a lot of this social media is false or counterbalances it? Is there some type of source that we could say, this sounds incredible, is this really true? Is there a way that we can go to another place to verify?
Oh, yes. So to study whether something is beneficial online, I'm sharing a link on evaluating health information, internet health information first. And it goes through, I think, 5 different major foci. But there are different areas that you can also check out. There's iMedia Ethics. There is Fact Check, which has a SciCheck as well. Health News Review still occasionally publishes some things. Politico has a healthcare section, and then there's healthfeedback.org. So let me find that and share all of those as well. So if you wanted to quickly assess whether something is true or not, I would recommend that. The problem that might happen if someone was diagnosed with, say, leukemia, it's very frightening. The problem is this person might have just graduated high school and they don't have the medical terminology knowledge to read and look at the original studies. And where do you go to look at the original studies? So what I generally recommend is to go to, say, Medline Plus. At that time, when I worked in public libraries, I would go to Medline Plus because that would allow people to look at the basics for them, and they can find things in easy to read. Generally, that website, medlineplus.gov, is at a 6th through 8th grade reading level. And the reason why it's so high is because some of the medical terminology on there. But they do have an easy to read section for 3rd through 5th grade reading level for some of those people too. But what I like about Medline Plus is that if someone can read at a 6th through 8th grade reading level and they understood everything shared on that page for a particular disease, like high blood pressure, for example, they can then click on research, and that'll take them to PubMed, so they can at least look at some of the abstracts and everything there. So when I worked in public libraries, that was something to start with, and it would help guide them further if they wanted more detail, or if they were like thinking, okay, I have something that is a little bit more newish. For example, let's go straight to COVID-19, for example. And they're very scared if they hear that their mom was diagnosed, for example, or a friend was diagnosed. So they can go to Medline Plus, look at COVID-19. They can see like what are the true clinical trials right now. There's so much unknown about this disease, even how the disease spreads can be very confusing. Is it safe to take my mask off while I'm out in public? If I'm walking outside with a friend in the park, for example, should I wear a mask? Should I not wear a mask? Have they exposed me if I'm wearing the clothes that I wore outside? If I'm flying to travel, which I did, like what is the appropriate distance I need? And should I take off all my clothes when I get home before I like meet people, shower, delouse myself, and put new clothes on, for example? And there's a lot of like, I'm scared, I don't understand things. So that's kind of like where I could start out with people so that they can start looking at where the facts are coming from. Right now, I think the federal government is saying we should just rely on the CDC for that kind of basic information. But I also look at NIH's research as well to see what is the new stuff emerging. And I know that when South Africa researchers identified the Omicron virus and people were like downplaying it, the reality of that is South Africa in general is the most hardest hit in regards to HIV. They have a ton of researchers in South Africa and are able to identify a lot of things faster than other people can. And I think due to news resources, there's racial bias, if I want to be honest, in the news media too, that when you look at a story that comes out of South Africa, it's downplayed oftentimes. And it's very unfortunate that that happens. So I think that that's about it that I have time for. Marcia, do you need to talk about other things as well? Or are there more questions? Sorry, I keep blabbering. That's me though. You're muted currently.
I see. First of all, is there any other questions that people have a burning desire to find out? Anything? I thank you about some information that you touched on CDC and in the websites that might be more understandable for people to have a quick knowledge. I think that is, a lot of people don't know that, and they have no place to go to give, because the internet is scary too, because they blow up so much and it's out of control and say, oh my God, look at those. So people need some of the basic facts about information. So thank you for giving us a few of the information, and I will, on if there's anything else you want to put in the chat, let me know, and I'm copying it all and we'll post that for anyone that might need information.